So when we talk about fear is a natural defense mechanism that we have developed for our own survival. It's a very appropriate emotion to have, which just tells us or makes our mind and our body prepared that there might be a danger around, there might be a threat around. Okay, so when we talk about fears, it is also very appropriate to have few fears as per our age or as per our developmental levels. And all of us would have gone through these age appropriate fears at some point in our lives. And as we move across these developmental years, or this particular age span, these fears usually start to they usually start to go away on their own. So in order to understand typical fears in children, it is important to understand how they are related with their developmental period, how they are related with their developmental milestones. So an infant, 0 to 2 years of age, the normal fears for any infant to have is a separation anxiety, or stranger danger, or being uneasy when there are loud noises around, or being uneasy with large objects in the surrounding. These are very normal fears to have in a child till the age of 2 years. Then in early childhood, from age 3 to 6 years, it's very normal, and children do have. I request everybody to please keep yourselves on mute. Okay, so in early childhood, it is very normal for any child to have a fear of imaginary creatures. You know, these creatures which are either introduced to the child in the form of stories, in the form of creature, if they're not doing some sort of work. So we create this imaginary creature, that this kind of a monster would come if you're not sleeping on time, or if you're not eating, he will come and he will grab all the food. So something of this sort, just the imaginary stories or any stories that we are communicating it to the child, those fears develop in those children at that particular age. Then fear of certain noises, especially loud noises. Children at this age are very susceptible, so they become very uncomfortable when there are a lot of loud noises in the background. Sleeping alone, darkness, body injury, animals, thunder and natural events, doctors or hospitals are also very fearful, especially at this age. Then in middle childhood, from 7 to 12 years, school, health, family, it kinds of become a very close-knit space. So fear of not being included in the class, fear that I might not perform that well, fear that my friends don't like me, or certain natural events, or the fear of loved ones. So these are certain fears that are very persistent across this particular age group. Then in adolescence, again, because adolescence is specifically a transition that children go through, right, within their physical body, also the physical features developing, socio-emotional development is also happening at this age. So they go through a lot of changes within themselves, and these changes at times become really uncomfortable for children. So there are a lot of fear of new experiences, like we start becoming uncomfortable with our own bodies, the way we are growing, or school performance in terms of how am I perceived by my friends, am I being included in that social group, or peer pressure is what we call it. That also becomes a very prominent fear, especially in this age group. Again, social competence, social performance, health, natural disasters. So these are some of the very prominent fears in this age group. Now, how do these fears grow? So as the child progresses by the age, these fears usually reside. Like a 19-year-old or a 20-year-old might not have a lot of peer pressure operating as compared to a 13 or a 14-year-old having that. So these usually subside as with age. Or a child who's 5 years and he has difficulty sleeping alone, but by the time he reaches 11 or he turns 12, he might be okay sleeping in his room, right? Or all these teenagers who just want their own space, they want their own personal time, they do not want to be disturbed, right? So these fears, as per the age progresses, these fears usually starts going away. Why? Because they start gaining insight, they start developing this reasoning, because of which they're able to identify the cause and effect, they're able to identify the rational and the irrationalities behind any fear. So it might go away, or it usually does go away. But if it doesn't go away as per the age, like if I see that my 13-year-old is still having difficulty in terms of going out and speaking to a stranger, or he still has difficulty in terms of visiting the hospital for even getting the most important vaccinations to be done, so then it needs to be taken into consideration. Then I need to see, right, how I can intervene, maybe as a mental health professional, how we can intervene as a caregiver. So that needs to be considered. If there has been a prominent gap, it kind of seems that it is not appropriate for the child to hold that fear, especially at that age, then we need to start paying more attention to it. Otherwise, specifically going by this, it is very appropriate, and they usually go with age, especially these fears.